Dr. Jeff Pothof joins us now to take your calls at 608-270-9933.
It is a great day to call in. We have 4 lines open if you have a question for Dr. Pothof, and it doesn't necessarily have to be about COVID questions. We'll take any of your medical questions.
But speaking of COVID, are we too complacent right now?
I mean, right now I think we're in a pretty good spot. So, COVID numbers have been relatively stable. Whether folks have been vaccinated and they've got immunity from that, or they've had COVID somewhat recently, they've got some immunity from that. We're not seeing as much severe disease. I think the risk would be as time goes on and people don't have COVID, it'll be important to keep up on those boosters so you have that good protection against severe disease. Otherwise, we could see some more severe disease come back.
So do you need a booster if you've had your 5th one?
Not yet. So if you've had that new bivalent booster, it came out, I think, in September, and you've gotten that one, you're good. Next one, I'm thinking probably early fall.
Okay.
Okay.
All right, let's go to the phones. We'll start with Barb from Portage. Hi, Barb. What's your question?
Yeah, I have a question. My footprints, when I walk, I lose my balance.
Okay, she's dizzy when she
And
dizzy.
I'm trying to figure out how to do my safety when I'm walking.
Yeah, so a common problem. So folks, especially as they get older, walking can become a challenge. And when we think about walking, there's a few things that need to happen. One, your feet have to have enough sensation so that they can tell where you are. Diabetes and things like that causes neuropathy can reduce that. Your middle ear has to be working well, otherwise you can't really tell where you are in space. And your vision needs to work well. And as those things get a little bit worse, you can get a little bit off balance. It's important for folks to try to reduce trip hazards and things like that.
Throw rugs.
And things like that. And then if you're still struggling, really important to talk to your doctor because it could be any number of these factors that contribute to being off balance. And sometimes there's things we can do to help with that.
All right,
Okay,
very good.
so there is help.
Let's go to Ann in Madison. Hi, Ann. What's your question?
Hello. My question is about the COVID vaccine. Is there a new COVID vaccine coming down the pike that will include variants that occurred after Omicron?
Interesting.
This is a good question, and this question almost like foretells what the future will be. So right now, all of our current variants are lineages of Omicron. Even the ones that are the most common today aren't the original Omicron, but still part of that family. What we hope now is that in the future, we will know what the most common variant is. Let's say something happens that is an Omicron, and the booster vaccine will be based on whatever that new variant is. That could happen as soon as this fall. Maybe it'll take a couple years, but that's the strategy, is to match the booster to the current strain, and right now that's Omicron.
All right.
Interesting. Thank you for calling.
Let's go to Jerry in Madison. Hi, what's your question?
My question is, my son was never vaccinated, and he got COVID. Does he need to have any kind of booster or any series of the vaccine still?
Yeah, so this is a common thing. So you get COVID, you weren't immunized. Now, do you get vaccinated? Do you not? And in general, the answer is, yeah, it's not a bad idea to get vaccinated, even if you've had COVID. Now, more recent research suggests that even after that infection, you're going to have a period of time where you're protected. So it's not like you have to run out and get vaccinated the day after you get that infection. But 3 months later, for sure, and certainly as you get farther out, 8, 9, 10 months, you'll lose any protection that you have from having COVID-19. And then you want to get that vaccine series, either the 2 series, or if you've had that and you've just been late on the booster, get that booster shot. That kind of like brings you back up to full protection as time goes on.
But it sounds like he didn't have any, so you'd start with the original.
Yep, you'd start with that 2-dose series, and then you'd add boosters after that.
Okay. All right, let's go to Tanya in Rio. Hi, Tanya. What's your question?
Hi, my doctor put me on Cymbalta. I was wondering if that would really help with my fibromyalgia pain.
Yeah, fibromyalgia is such a debilitating disease. You can hurt all over. Doctors have been trying a lot of different things. Cymbalta is not a bad choice. They use other medications, gabapentin, nortriptyline, things like that, but it can be a difficult pain to manage. So I'd say go ahead and try the Cymbalta. But if that's not working for you, be on the horn with that provider and say, hey, I'm still struggling. What else do we have that I can try?
But it's a prescription. You have to go through
It's
your
a
doctor.
prescription drug, and you need it from a doctor. Yep.
Okay.
Angie in Jefferson. Hi, Angie. What's your question?
Hi, I was just wondering about the nasal mist that I've heard that's coming out or that's been being tested for COVID as a vaccine.
Yeah, this is an interesting thing. So what they're trying to develop is a COVID vaccine that is a nasal mist instead of an injection. And there's really two benefits from this. One, I'd rather get something shot up my nose, some mist, than get a shot in the arm. But two, it can prime the immune system that's in these mucosal tissues that might be more effective at stopping the virus before we can have enough virus that it actually makes us sick. So the idea that these kind of vaccines might go back to COVID not being able to make us sick versus just protecting us from severe disease is a possibility. None of them are approved yet, but it's in the future.
I was just going to say, it's not on the market yet, not
Yep.
approved yet.
True.
That's interesting.
That might get a lot more people vaccinated.
It would be easier. I mean, more palatable.
Right, absolutely.
For sure.
All right, we are out of time, unfortunately. We have lots of calls waiting, so we'll do this again next time. Doctor, thank you.
Sounds good.
Thanks,
Yeah.
Dr. Pothof.
Good to
We'll
see you
soon.
guys.
Thanks for your calls.